Hernia repair surgery is one of the most common, if not the single most common, general surgical procedures in the United States. Hernias can be very painful, and they can also be, depending on where they are, they can also be potentially a serious medical condition that needs to be addressed. There are different ways to repair a hernia depending upon the size and location of it. One way, oftentimes for smaller type hernias, you can have what's called a primary repair. And a primary repair is usually when a doctor will go in and suture up an area, close what's called the defect or the hole to stop the protrusion from coming through. However, depending upon the size of the hernia involved, the location of it, and some other characteristics as well, physicians will often recommend the use of a mesh to ultimately place over to help with the repair. The one at issue here, although there are several different types which we can talk about, are usually ones that are made of polypropylene. And polypropylene is a synthetic material which is used in mesh procedures to create these meshes. The most common hernia mesh is a series of different products manufactured by a company known as CR Bard. Bard is a very well-known medical device manufacturer in the United States and happens to be the sort of 800-pound gorilla in the corner of the room when it comes to hernia mesh. Unlike other situations where I can talk about one particular product and a particular problem with it, this is sort of a wide range of different companies, different products, and different problems. Oftentimes, unfortunately, what they require is they require removal of the mesh, and when you go in the second time to do this, it's even more challenging and difficult and can be a really debilitating process for people. In the event that you start developing problems, you start feeling pain, you start noticing something that doesn't feel right, it's important to get to your doctor to tell him or her what's going on. Let your doctor diagnose it, determine if it's an issue, and what needs to be done about it. And then if that's a circumstance, God forbid that is the circumstance, then you call us.